I saw her, 8 weeks afterwards, up to 2 months. And at that point, most things have kind of worked itself out. And she looked incredible. I mean, and she came in for her follow-up, was like in tears. She was so happy. Her sister, wrote on all like some of my social media posts about her and was like, "You changed my sister's life." It was like it was pretty cool. But that was hands down, that's one of the hardest cases I've ever done, and one that I will always remember.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Brandyn Dunn, who is a fellowship-trained facial plastic surgeon and the owner of Coastline Plastic Surgery in Newport Beach, California. With extensive training and expertise in facial anatomy, he focuses on delivering both surgical and non-surgical treatments for facial rejuvenation. Dr. Dunn is passionate about providing outstanding care and creating natural, elegant results. His goal is to help each patient look and feel their best throughout their aesthetic journey. So Dr. Dunn, welcome and glad to have you here.
Thank you, Daniel. I really appreciate it.
So let's dive right into it. How did you first get interested in aesthetics?
So that's a great question. I will say when I started my journey into medical school, that was not something I was thinking about even going into. It was nothing I was exposed to, no interest in that. My background is in head neck surgery, ENT head neck surgery. So all of my surgery and everything that I've done in my training and my experience has just been related to the face and the neck. And so extensive experience in this area. And then as I started to do more and more kind of surgical procedures in this area, I grew really an interest into kind of the overall breadth of facial aesthetic surgery, the proportions, the mathematics, the geometry, all of the kind of balancing act that is created with aesthetics. And I actually realized that it's like a tool that I've always really had and something that I've always really appreciated growing up, but it wasn't something that I never thought that I would fall into this. But it's been fantastic, extremely rewarding, and yeah, it's been a great decision thus far.
Sounds good. Now, I'm curious, what are some of the common procedures that your patients come to you for? And also, why do you think that they're so popular?
Yeah, lots of different procedures. I would say the most common procedure, I would say I have two kind of ranges. So my younger patients that are in their 20s and late and early 30s, the most common procedure, hands down, is chin liposuction or neck liposuction, neck contouring. Those are procedures that really help primarily with those patients that have fullness or excess fatty tissue underneath their chin. It's extremely popular right now. The results are super transformative and they work really, really well and really, really quickly. It's easy. I do it in the office and under local anesthesia, moderate, not that much downtime. It's financially very reasonable. So that's like a fun procedure with a high satisfaction, and it works really well if you're a good candidate. Then my older patients, I would say, once you kind of get into your 40s, 50s, and 60s, those patients are much more interested in facial rejuvenation procedures. So that's like facelifts and neck lifts. And that's kind of like my forte and one of the things that I'm most interested and passionate about. It's a extremely satisfying and gratifying procedure because I get to like reverse the clock. Essentially what ends up happening is it's not like I'm transforming what you look like and how you identify yourself. I'm basically transforming you to a previous time where you looked younger and felt younger. And so it's not as much of a psychological kind of conundrum as something like a rhinoplasty where you kind of look like a different person. This is really satisfying as well. So those are my two, I would say, most popular procedures.
Okay, and I think that this is a good transition kind of into this next topic of facial aging. So
Yes.
talk a little bit more about the concept of facial aging, kind of what that means to the everyday person.
Yeah, so facial aging, it's going to affect all of us, unfortunately. And so, it really just depends on how much it bothers you. I think that's the biggest thing when it comes to facial aging is like, no one needs any of these services or procedures. It's really just how much these things bother you. I'll say that aging is something that we can slow down or we can help to minimize or mitigate if you start with interventions early. That's good skincare, that's sunscreen, that's, very, I would say, conservative and kind of natural approach to Botox and fillers and Sculptra and those types of non-surgical things. That helps with facial volume, skin texture, skin quality. As we get older, these non-surgical treatments just don't have what it takes to be able to give you those kind of results I think that patients are ultimately looking for. But facial aging, it's gravity. It's the effects of gravity. It's the effects of the sun. It's the effects of our diet. It's, all of these environmental stimuli and things that kind of work together that lead to the changes that we see in our skin, the laxity that we're seeing along our jawline, the deepening of our smile lines, the under eye bags, the excess skin of our upper eyelids, the laxity and looseness in our necks, those types of things. It's going to affect all of us. It's just, when it bothers you, I guess.
Okay. And I guess at what age it starts to bother you, then that's going to come down to then what treatment's going to be the best fit for you at that point.
Exactly. It all comes down to your anatomy. And that's actually an interesting point because, facelifts, people are doing preventative facelifts or, early facelift surgery. It's not that it's going to prevent aging, but there are some individuals in their 30s and 40s that are really bothered by the little bit of jowling and they want to kind of mitigate it really early. Those types of procedures, it's not for everyone. I won't say that I try to push that. I think that, I really come down to making sure that my patients make educated decisions and they feel comfortable with the decision that they're making and they don't end up doing too much too early and it becomes a problem.
Yeah, you mentioned that the facelift surgery is really your forte. So can you talk a little bit more about your specific surgical technique on how you do facelift?
Definitely, yeah. So I will say one of the most important things about facelift surgery is not necessarily the technique. I'm gonna give you some of the details, but it really comes down to the surgeon's results and how the practice and the surgeon makes you feel, because so much of this experience is, you want to see people that maybe look like yourself that has similar findings and concerns that you may have and see what they look like and see if that transformation is something that you're interested in. But it's not just the surgery. I mean, the surgery is definitely, it's one day, but the healing process takes a year. There's questions, concerns, things that come up. These are big procedures and big decisions and financially very, a big expense. So it more is about kind of the whole experience and making my patients feel comfortable. But yes, as far as the technique, there's a lot of different techniques for facelift surgery. And I will say that we as a community, as a plastic surgery community, facial plastic surgery community, have made such incredible advancements in facelift techniques that people are looking so much more natural. All of these unwanted complications are so uncommon now that it's really nice. And the reason this is happening is because of two major advances in techniques. The first one is a deep plane facelift. Essentially what that means is doing surgical work on the deeper structures and the deeper tissues rather than working on the top layer. Sure, you can pull the skin on the top layer and it looks like everything's getting better. But the thing is these top layers are tethered down to the deeper structures. And if you don't release the deeper structures from these top layers, then you're ultimately going to get recurrence and relapse and pulling, and you really need to pull and create more tension than what's needed. And so that's when you can get those unwanted complications. So deep plane facelift. The second one, which is one of the newer techniques that I think a lot of surgeons are starting to introduce, and something that I've been doing for a while with my patients, is something called a preservation style technique. So what does that mean? So in facelift surgery, we essentially would dissect a lot of skin from the deeper structure. So deep plane facelift surgery has been around for a while, and we would dissect very far forward into the face and into the neck of all of the skin. That's good because we previously thought that you need to free up the skin from the deeper structures to be able to get everything to kind of tighten up and lay down. And in some patients, you do still need that. But when we lift the skin, it increases the chance of other complications, hematomas, seromas, things that just are hiccups along the way and can be problematic during their recovery. And the other thing is it also can affect the skin quality a little bit too. So this preservation technique is we minimize the amount of skin dissection that we do while still going into the deeper plane and actually doing the deep plane technique. So those two things together have allowed befores and afters and my patients to look the most natural they possibly can look nowadays.
Got it. Now, when it comes to new or emerging treatments, would you say that the techniques you just spoke about, that's kind of the equivalent of like the new and emerging treatments in the plastic surgery space? Or would you differentiate between an improved technique and something that's like completely new?
That's a good question. I would say it is the deep plane facelift has been around for a long time, actually. It's been around for 20, 30 years. It the thing about the deep plane facelift is it was some areas it was in deeper tissue, so it was like modern advancements, so it became a little bit adjusted. The preservation technique, I think, is more of a new modern transformation, and I think it's just that's a different thought process that has kind of been introduced to the field. So the thing about preservation is it can't be done for everyone because sometimes you have to contour that layer between the skin and the deeper structures. And if you don't separate the skin from the deeper structures, you can't do that. So my heavier necks or my fuller necks, that need much more contouring, I have to still separate it from everywhere so that I can at least give them, as dramatic of a result as I can achieve.
Got it. Okay. Now, Dr. Dunn, I want to dive a little bit deeper into your specific practice.
Yeah.
What would you say are some things that really differentiate your practice from others in the industry?
Yeah. So, you know, I I really do have my practice and treat my patients the way that I would like to be treated in this situation. And that's basically how I approach this. I would want someone to take care of me like a friend or a family member and, really kind of invest their time, energy. And we really do run sort of like a boutique type practice. I'm not, I don't want a super high volume where I can't take care of my patients the way that I would want to be treated. I think that having patients, busy enough to be able to make everything work, but also be able to, make sure that patients are still getting that great high quality care. So I think when patients come into the office, they feel like they're taken care of. I'm from Hawaii. I grew up in Hawaii, grew up in California and Hawaii, but spent most of my formative years in Hawaii. And the aloha spirit or ohana and that type of mentality, I really do bring it to work and to everything. I think it really does make a difference, and I think my patients feel the support. They really do.
Mm-hmm. Now, talking about the patients, how do you approach educating your patients on the treatments, the benefits? Because I'm sure that you get some people that come in and they're like, oh no, like I'm good. I've been doing research. I want this. I'm just trying to find the right person. And I'm sure you get others who are like, I've been thinking about this, but I'm really scared because of X, Y, or Z. So
Yeah.
how do you approach educating each and every type of that type of patient?
Yeah, I mean, education is really key to everything. My goal and my approach is really educating my patients and informing them to be able to make their decision that's best for them. So I really do, all of my chin liposuction patients that come in their 20s and 30s, I educate them about the pluses and minuses about chin liposuction. There's no free lunch in this world. There are pluses and minuses to every procedure that I do. And I tell them that, if you want to minimize some of these, potential complications or potential issues that could come up later, then we can do a neck lift or we could do other types of procedures. So I'm very much about giving them options. I do in some for most patients, I do think about it as an a la carte type of situation where you can pick and choose and add some things. Some people want to do everything at once, and some people want to do things in piecemeal. But I do think that education is key to patients understanding and making the right decision for themselves.
Okay. And for people who are not aware, could you explain a little bit more about what's the difference between the procedures that a plastic surgeon would offer versus one that's like non-surgical that like a med spa would offer? And in what situations would you want to consider each one?
Yeah. So, I guess every plastic surgeon is obviously different. I think that plastic surgeons can do, non-surgical and surgical treatments, which I think is nice. I think that, my understanding of the anatomy being in the face and being in the neck allows me to, I believe, do non-surgical treatments maybe to a greater degree because of my understanding of the anatomy. But I also think that there are incredible injectors and incredible providers at non-surgical treatment options like med spas that do exceptional work. I think there still are, things that come up when I do non-surgical treatments for individuals, and it's bound to happen when you do enough treatments. So, I mean, I guess to answer that question a little bit more clearly is like I think that med spas are making a lot of non-surgical treatments accessible to the public a lot easier, where you feel like, going to a plastic surgery office, people maybe feel daunted by they like, oh, they're just going to push surgery. You just have to do surgery. But I think that me still doing injectables allows me to kind of offer patients that are maybe not ready for surgery, non-surgical treatment. So yeah, I don't know if that answers that question, but
Yeah, no, it definitely does.
yeah.
Now, what I want to get into next is the common misconceptions you hear from your patients about the treatments you provide. I'm sure you hear a lot of misconceptions or just misinformation. What are some of the most common ones that you've heard?
That's a good question. There's so many. I'm trying to think. I think one of the biggest ones because of chin liposuction is that if you wear the chin strap before your chin liposuction, you're going to have a result similar to a surgical procedure, which is not going to happen. But I'd say some of the misconceptions, I think one of the biggest misconceptions that I typically run into is, and this is like partly, I think, my fault too, but like I have a lot of really great liposuction results that I show on my Instagram, social media, and all of those types of things. And patients will come in their 40s or even early 50s and want liposuction for their neck. And I think the understanding of what's going on that's contributing to the fullness and all of these things in your neck, or maybe, they think that one thing fixes all, but it's, it really has to come down to a tailored approach with anatomy and, the best decisions with all of that information. I don't know if that answers as well.
Yeah, that's fine. I'd like you to kind of explain also, because when it comes to the aesthetic landscape, I think for the average person, it can be very confusing to kind of figure out what do I need, who do I go to, what's the pros and cons, what's the potential risks that I need to consider. So could you talk a little bit more about like, if I was just your average everyday person that was kind of considering some type of treatment, where do I even start? Because like, I don't even know where to start with all of this.
Yeah, I mean, even myself feels overwhelmed by some of these things. And I think that that's kind of the important thing to understand is like, this industry is always changing, hopefully for the better, but there's always trends and things that come up that are not, that don't always work. And so I think it's really important to find a place and people that you can trust that have credentials. I think that that's another thing is there's a lot of people in this industry that maybe speak about, knowing particular things, but maybe don't have the credentials and the backing behind that. And I think that that can sometimes be overwhelming. And, there are a lot of things that are overpromised in this industry. And I think one of the things that I like to really do with my patients is I'm very frank and I'm very honest. And I don't see myself as a salesperson because I really see myself as an educator, because I don't want to have someone expect a miracle when it's not going to actually, filler is not going to be able to provide a facelift or lift the face or, so I think it's really important to go to someone that you can trust that's not necessarily trying to sell you something, and find a place where you feel like you can ask questions and find a place where you feel like they appreciate your time and your business. And I think those things are really important in this space. And there's a lot of great people out there. And I feel very lucky to be in this industry because I think like as a community, I think we're trying to do a lot of good things. There's a couple bad apples, but overall, I think everyone is really doing great work.
Yeah. And I think that's great advice to someone who's just starting off. They don't know like what to do, where to start. And I think another big issue, I think this is for everybody, is like how do you find that right source, like the one that you can really trust?
Yes.
I was actually interviewing somebody else, and they're saying that like one of their frustrations is that people out there in the marketplace who may or may not have the credentials, may or probably don't have the background or the experience or the knowledge is putting out this information saying that, oh, never do this treatment because it'll do this, this, and this. And then this patient comes to this provider and says, oh, this other doctor said don't do this. And she has to explain to them, like, no, like the treatment is fine, but in this situation, you have to be aware. In this situation, be aware. Like there's no context behind it.
Yes, yes.
It's hard to like listen to, and it's like, do I take it as gospel, or is there always going to be a caveat with this advice?
Yeah, and I mean, I think, being critical and having a little bit of self-doubt, I think is very reasonable in this space. And I agree with I deal with that. That actually just reminded me, buccal fat removal is probably one of the procedures that I think most patients are very concerned about, because there is a lot of bad information out there that talks about why no one should get that removed, why it's terrible. But the reality of it is, if you have the right anatomy for the procedure, then you're a great candidate. But if you have the wrong anatomy and you get it removed, it's going to look terrible. So it's really, exactly, it's context that needs to be built. And I think finding people that you can trust is critical.
Mm-hmm. Now, once people have kind of gone through this stage of figuring out what's the right treatment for them, finding the right provider who can do this treatment they feel they put their trust in. Now, in your situation, how do you balance between providing that relaxing experience where they're not anxious or stressed out about this, but also ensuring their safety and well-being during the treatment?
Yeah, I mean, it depends on whether it's an in-office procedure, like a non-surgical procedure, or something in the OR. I think, again, it depends on how much you want to know. I mean, for me, again, information is key to everything, and education is key to everything. So, I'm happy to kind of talk about the whole experience and walk you through your experience if it's like an in-office procedure. If it's something as simple as like Dysport, which I use in the office, I'll use, the smallest needle and distraction tools and all of these things to make sure that it helps with anxiety and, make sure that you're comfortable and you feel as little pain as possible. To being in the OR, like a facelift, I'll sit down and all of my pre-ops and consultations are quite a bit of time to kind of go over everything and answer all of the questions. So yeah, there's no way around the anxiety about the procedure. I mean, it's going to happen. And I tell all my patients, I say from the day, typically at pre-op, which is around 2 weeks or so, most people are excited, but anxiety is like starting to creep up. And then as it becomes like closer to surgery day, it's like anxiety starts to go up, excitement starts to go down, and you start to questioning everything that you just made a decision for and all of the money that you put down. And I tell all my patients that because I see it time and time again. When I get to pre-op, everyone's, a little bit anxious, and you're excited afterwards. It all works itself out. Okay.
Now, I want to ask, when it comes to medicine, like most people think that, okay, there's a procedure, there's a step-by-step process, there's a protocol in place. But I want to get your thoughts. What role do you believe creativity plays in how you approach your patient care?
Yeah, that actually brings me back to one of my first experiences with facial plastic surgery. I had a mentor in Hawaii, and where I went to medical school, and he asked me, I was a medical student, a resident, a fellow, and himself. So there was 4 of us, and there was a skin cancer defect, which is another thing that a lot of like plastic surgeons, facial plastic surgeons also do in their training. I don't do much skin cancer reconstruction anymore, but we all 4 had a similar defect. It was an older woman who had a skin cancer defect of their forehead, and it was a decent size, about the size of a quarter. And he said, these are the 3 major concepts of reconstruction. This is what we want to be able to achieve. We want to, make sure the hairline lines up. We want to make sure the skin looks the same. We don't want to distort any of the structures that are close by. Design different techniques. With your experience, design different techniques of reconstructing this. And it was really cool. That was my very first experience, and I had very little experience. The resident had a little bit more, the fellow had even more, and then him. And we all came back to the drawing board after, an hour of sitting down and thinking about it, half an hour, and we all had different ideas. And that to me is like what cosmetic surgery, and this is actually in everything. There's no right answer. Every little thing, I do the same steps, I do the same procedures, but overall, the vector that I pull when I do a facelift is different for every person. It depends on their anatomy. The techniques are ultimately the same. The surgical technique, the suturing, the cutting, the cautery, all of those things are the same, but everything is a little bit different and nuanced and unique. And I find that super satisfying. And that was like one of the first early experiences that I found really interesting that kind of tied me in.
Mhm. I think that's very powerful, the way you explain that, because I think most people think about, oh, like everyone kind of follows the same process. There may be a little bit of variation, like they have their own personal signature or spin on it. But I think the way that you describe that is like there can be, I won't say vastly different, but like quite varying approaches to do the same procedure. It just
Yes.
comes down to how do they view it in their mind? What do they believe is the best way of going about doing that? So I never really like I've talked to a lot of plastic surgeons, but no one's quite explained it like that. Like I
Yeah.
didn't realize there was so much freedom for you to kind of decide how you want to get to the end result.
Exactly. I mean, like the thing, we all ultimately have the same toolkit. We all have the same tools. We use the same instruments. We all know how to suture. We all know how to, dissect and do all of these different things. But it really comes down to the nuances of the manipulation of the tissue and how, the tissue handling and all of these different things that ultimately lead to different results. How much time you take, how much care you take, how much precision you spend. Yeah, it's really that's the stuff that I really like and I find really satisfying. So yeah, that's kind of
I guess one analogy is not the right word, but like I guess one example that I can think of would almost be like you all have the tools to like build a house, and the end goal is you want to build this two-story house that's blue.
yes.
You just give you, hey, here's the tools, here's the materials, and then
Exactly.
go do it. And then everyone's gonna have
A
different
different
houses, but
approach.
you're all gonna have a
Yep.
blue two-story house.
Yes, yes, exactly.
Okay, okay.
Yeah.
Got it. Now, Dr. Dunn, I'm sure that throughout your entire career, you've run into some particularly challenging cases. Would you mind sharing maybe one story of just a tough case that you had and how you were able to work through it and get them a successful outcome in the end?
I mean, every case does have its challenges and every case has its nuances. I think, actually this brings me back to one of my challenging cases. I don't do a lot of these anymore, but it's something that it reminds me of when I think of it. Our foundation is in reconstruction. A lot of our foundation and understanding of anatomy and understanding of tissue planes and how to work with tissue is in reconstruction. You don't start off when you learn these things doing an elegant deep plane facelift preservation technique. So one of the procedures that I had done that was really challenging was a young woman who had used actually cocaine for many years and developed a septal perforation, which is basically a large hole in her septum. And as a result, your septum is actually one of the structures that support your nose. So when you don't have a septum, the tip of your nose and the major supporting structures of your nose just kind of collapses in. So the nostrils collapse in, the septum and the tip of the nose collapse in. And her nose was extremely contracted because it's been like that for many years. And cocaine, this medication, will decrease the blood supply. So it decreases the vascularity, so it causes things to scar down. Yeah, it was a really tough case because there's not a lot of tissue to be able to reconstruct it. And she has lived with this for a long time. And so she actually came to me in my fellow clinic, and this was something that it was a big pill to swallow because she knew I wasn't someone that has been doing this for a long time. I worked closely with one of my mentors and colleagues, and we did a reconstructive rhinoplasty. It took 6 hours. And I had another team with us that helped to harvest the rib cartilage to be able to get rib cartilage to be able to reconstruct her entire nose, give her a nice supporting tip to strengthen and support her nostrils. It's not, or rhinoplasties take forever to recover. It takes, a full year to actually recover. But, I did this towards the end of my fellowship, and I saw her, 8 weeks afterwards, up to 2 months. And at that point, most things have kind of worked itself out. And she looked incredible. I mean, and she came in for her follow-up, was like in tears. She was so happy. Her sister, wrote on all like some of my social media posts about her and was like, "You changed my sister's life." It was like, it was pretty cool. But that was hands down, that's one of the hardest cases I've ever done, and one that I will always remember.
I think that's really important. This whole concept of like, whenever I ask people like, what's your best success story? Like, what was the most challenging case? What's the one that you remember the most? It's almost without exception One where it was someone that had some type of, not deformity, but like something that didn't make them look normal, and they just wanted to look normal again. Like they just want to feel like themselves again.
Yeah.
And I think that's what is missing in a lot of people's perception of the aesthetics industry. And you
Mhm.
also got, like the way you explained it also, it kind of made me realize, and I'm in this industry, like it still made me realize that you said that plastic surgery really has the foundation in reconstruction.
Mhm.
And so reconstruction is like you're basically fixing something that was damaged or destroyed. And I think that most people, when they think of plastic surgery, the first thing that comes to mind is, oh, it's just about vanity. It's just about maximizing your beauty potential. It's
Yeah.
not about trying to get you back to normal. Like you're down here, you just want to get back to normal.
Right. Right.
And I think that's something that a lot of people, they should change their perception about the industry, about plastic surgery. It's
Mhm.
about making people feel good about themselves,
Exactly.
or so they feel good about themselves.
Yeah. Yeah, I mean that brings up a really good point, because one of the things that again, not something I even thought about, like plastic surgery, facial plastic surgery, but one of the things that I realized once I started practicing and in my training and all of this stuff, I mean 99.9% of the individuals that have surgery are just everyday normal people. There is nothing, and everyone is just normal, just wanting to feel good about themselves. And it's pretty cool. And that makes it so satisfying, because, and that's why I feel invested in my patients and want to put the time and energy and, treat them like family, because they're just normal people. It's just so, definitely, I agree with you.
Now, Dr. Dunn, where do you think the future of aesthetics is going?
It's bright. It's bright. I'd say regenerative medicine is like a really big hot topic. Wellness, kind of treating comprehensively. I think just this idea of, just doing one thing, kind of just doing filler, really big lips, all of these different types of things. And I think natural is the other way of the future. So I think the pendulum has finally swung in the right direction. I think that we're now kind of moving in an approach where, our beauty standards are becoming, and just aesthetic standards are becoming much more natural. I like that, because that's my aesthetic, and it's something that I feel comfortable and confident kind of posting those types of those patients. And yeah, I think the other thing about this with social media, good and bad with social media, but it's holding everyone to a really high standard. It's stressful. Every single post and every single picture, you feel like it's got to be absolutely perfect, because all your friends and colleagues and patients and everyone is looking at it so intently and closely. And so, in a way, it is elevating and increasing our ability to achieve better and better results. So I think I really do think the future is bright.
Awesome. Now, Dr. Dunn, I have one last question for you, but before I ask it, I want to point people to your website at www.coastlineplasticsurgery.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure done, but isn't sure which provider to choose?
Like I said kind of early on in this, I think the most important thing is the results are clearly one of the most important, are very important. I get that. You want to look good, you want to feel good, you want to look natural. But I really do think you're paying for more than just a result. You're paying for an experience. And find a surgeon, find an office, find staff that you can trust, that you can turn to, because plastic surgery is not like getting your hair done or getting your nails done. It's not like an in and out procedure. We become friends, we become family. We're going to see a lot of each other. So find people that you can really count on when you have your highs and you have your lows during this recovery and journey. So I think that to me, I think is really critical in finding an office and a surgeon that you can trust.
Okay. Well, there you have it, Dr. Dunn sharing his expertise. So Dr. Dunn, where can people contact you and your practice?
So you can find us at, like you said, at our website. You can give us a call at 949-849-0336. And I think most people actually, reach out these days on Instagram, TikTok, those types of things. I say Instagram is kind of my more common approach, and it's at Dr. Brandyn Dunn on Instagram as well as on TikTok.
Awesome. Well, thank you again for sharing your knowledge, sharing your expertise, and sharing your message.
Thanks for having me. I really appreciate it.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.